Welcome, dear viewers, to our format today, Natural Medicine. Today I have the Chief Physician of the BioMed Center Sonnenberg with me, and we are talking about polyneuropathy today. What is it actually, and what possibilities do we have to bring the body back into regeneration as best as possible? You will find out today. Stay tuned. Hello, dear Alexandra.
Hello, Karina.
It's great that you are here. Today we are talking about polyneuropathy. What exactly is it?
The direct translation of the word poly means many neuropathy diseases, i.e. many nerve diseases. Polyneuropathy usually refers to nerve diseases of the peripheral nervous system. The peripheral nervous system is everything that lies outside the brain tissue. What lies in the brain tissue is the central nervous system, i.e. the brain and spinal cord. What then runs out of the spine or certain holes in the head are the peripheral nerves. Polyneuropathy is a little more specific. Polyneuropathy refers to emotional disorders and nerve pain that occur in the feet or arms. The most common form of polyneuropathy is pulmonary nerve disorders, i.e. the result of numbness or irritations. The most common form of polyneuropathy is pain in the leg when you only brush over it. There are so-called strump-shaped forms. There is also a riding breeches form, which is a little different. This refers to the thighs or the upper arms. The most common form of polyneuropathy is the one that starts at the end of the foot and then goes up, or from the fingers going up. The most common form of polyneuropathy is the one that starts at the end of the foot and then goes up.
Have there always been such diseases? Or are we again dealing with the effects of environmental pollution?
I can say it for other diseases. I don't know exactly when polyneuropathy is mentioned in history books. There are a few substances that people played around with 2000 years ago. It could be lead poisoning. Otherwise, polyneuropathy is a phenomenon of civilization. It is not uncommon in patients with diabetes. It is not uncommon in patients with a metabolic syndrome. That is a combination of high blood pressure, overweight, and disturbed sugar.
Is it the sugar that affects the vessels? But these are nerves. It should be something like a toxin.
Yes and no. With diabetes, the blood circulation is disturbed and the nerves are not properly supplied. I also know other theories. Especially with diabetes, with the high sugar levels, it could be neurotoxins. Toxins that are produced by metabolic changes and deposit on the nerves. Then you have to say that the glucose molecule itself, if the concentration in the blood is constantly too high, can deposit on certain body structures without the need for a catalyst. The amount of concentration affects certain molecules or proteins due to shift-base binding. We make use of this diagnostically by measuring HbA1c, the so-called blood sugar long-term value. Hb is our red blood color. But sugar does the same with collagen. Sugar can glue collagen together. It is difficult for the body to break it down again. But it can also stick to other molecules up to the nerves. But I also have metabolic syndrome, diabetes. I always get mixed images. Mixed images in the sense of people who have something like that don't often have stomach aches. If you have stomach aches, you usually have a B12 deficiency. I like to repeat myself here. A B12 deficiency is not typical for vegans or vegetarians. I also get mixed images in the same amount. I have also experienced many patients. No, my B12 level is good. It has already been checked. Then I see the value, which is 200, 300 or 400. And I think, well, just above the normal range with 200. Well, let's assume that it is a deficiency. I mean, I can throw a coin at the value. Then I have to do other tests. The easiest way is to put a fork on the big toe, on the ankle, on the kneecap. And then I already have a disturbed vibration feeling. That is the most sensitive parameter. And then I already know how high it goes. And whether it is the same on both legs. If I only have it on one leg, for example, then I ask, have you ever had a disc herniation? Then I say, well, then it's probably not a polyneuropathy.
Again, about the intake of B12. First of all, can I overdose it? In what form should I take it? Are there a few things to consider?
Yes, recently I had like my B12 is good. It's insanely high even. I'm overdosed with it. Probably not, because your blood picture, the subunits of the red blood cells, by the way, show me the opposite. Or your homocysteine shows me the opposite. I can measure it even more precisely. If I find it there, I won't measure it any more precisely. What you have is, you have taken in B12 and then it was very high in the blood. But it didn't go into your metabolism, or into your nervous system, because it was the wrong B12.
What is the right one?
Use of the wrong B12. If I have something on my stomach, then I don't take in any more B12. Because the stomach binds a substance called the intrinsic factor. The B12 is the extrinsic factor. They bind together to then be absorbed. If I have something on my stomach, or gastric acid blockers are poured out watering can-like over people at the moment, then I have a disturbed B12 absorption. Other things too, but also B12. And to avoid that, you can take activated B12. Activated B12 are the forms of adenosylcobalamin and methylcobalamin. I prefer to give it in droplet form, so that you really suck it in your mouth, and that it is absorbed directly through the mucous membrane.
I once heard that you have to be careful with B12 and tumors. And with cancer and so on.
Yes, I've heard that too. But I also know a study that says, hey, if I have a too high homocysteine value, which is caused by a B12 deficiency, then I have a higher chance of metastasis. Sure, I mean, what is a tumor? It's not an alien, but it follows, in a certain way at least, also natural laws like other cells do. It has its own rules. But it doesn't consist of any atoms or enzymes that come from the moon, I would say. That means, of course, such a cell also has a certain need for nutrients and food. But I always have to think carefully whether, when I starve the tumor, I go. I don't know, I see it very critically. I can't let it stand like that. 100 years ago, it may have worked like that most of the time. Do I pay too high of a price for it, by starving my own cells? I can't have a normally functioning immune system if I have a B12 deficiency.
Back to polyneuropathy. Is there? We've already heard it with the tuning fork. How would you approach it in general? Do I have a chance of healing?
It always depends a little on the cause. Sometimes you have to say, if someone gets polyneuropathy after 30 years, maybe that's an unrealistic number, let's say 10 or 20 years, I can't make a promise of healing. Roughly speaking, All symptoms that fluctuate, I can make better. What do you mean by fluctuating? Sometimes worse, sometimes better. I get a kick in the door, at least to the level that gets better by itself. If something is so advanced that there is a kind of final tissue conversion, maybe better imaginable as a scar, then it gets difficult. But if I have AB12 deficiency and I give it, then it makes sense to give it reasonably for a year in a reasonable dosage. Because the nervous system is more like a slowly metabolized tissue. And it definitely makes sense to wait at least that long for it to get better. If someone has AB12 deficiency that doesn't last long, has diabetes that doesn't last long, my God, you can get that pretty well. But of course, these were the examples for very common things. Of course, this often has to do with poisoning or with chemotherapy side effects. Maybe I can't handle chemotherapy side effects that well. Depending on the type of chemotherapy, I once had a patient who had cancer. She got cisplatin, and then with, I think, 2 or 3 times chelate therapy, the complaints were gone. But it often depends on which metal. Not all metals go out equally fast and easily. How is the patient from his detoxification status? How well can he detoxify? How full is he? In the meantime, I prefer to go a little slower, onion-like. If the patient is already full and you can see it, it's overflowing everywhere, whether it's over the skin. Now I had another patient who said, I already have side effects when I eat dandelion. Well, then I don't start with gelatin therapy. Then I'm very careful with other things. Go in there first.
Okay.
Step by step. I have to see whether I prefer to fill up deficits, intestine, gastrointestinal tract, intestinal liver care, the diversion paths, that I can detoxify at all. Otherwise, I do the 4th step before the 1st step. That goes backwards.
What happens to me now with clients is that they came from their doctor with the diagnosis of diabetes. They also had a HbA1c of 10.1 or 8 or 9. And I thought there are no classic type 2 diabetics. And then they often just had fungus in the intestine, putrefactive bacteria, fermentation processes, which somehow brought this HbA1c up. And when they then had renovated the intestine, the issue was solved.
That's not a question at all. That the approach is at the intestine and diet.
Is that a challenge? How do you do that with the metformin? He now has an artificially increased HbA1c value, but just because it constantly gnaws and folds in the intestine. If he now has a real intestinal cleaning treatment with flaxseed and herbs or whatever, what does he do with the metformin? That can be dangerous, right?
No, not metformin. There are other antidiabetics that are now being mixed with very new ones. You have to be careful. Metformin is one of the less dangerous ones. But you still have to be careful. I had a patient who at some point had a change of diet, very classic metabolic syndrome, and thought, I'm happy about it. That's my easiest task. I'm happy about it, but it won't be as easy for her. I know I'm going to challenge her a lot now. It was very nice. He brought his wife to the next meeting and she said, I'll do everything. That's great, we'll make it. He was a very nice man, and maybe not very talkative. I always had to pull everything out of his nose. And then I ask, he doesn't notice much of the change. He didn't come because of diabetes primarily, but because of a sequelae of diabetes. And then, do you get along with the food? Yes, on the whole, yes. I also find the smoothies very tasty. But in the afternoon, I'm really hungry. Then we have to look again. Then we got to it. I said, you know what? I said, yes, the HbA1c. I had it for 6 weeks. It wasn't worth it to measure it yet. Because we only do it every 3 months. Oh, this value. I've already done it in my household. And yes, 6.8. I said, okay, now I know why you're hungry.
What was it before?
Your sugar level is so low. You absolutely have to measure it now and probably cut out the metformin. But it's not in the sense of dangerous, but rather, I'm hungry again.
I once had a course for 70-year-olds, where we also changed the diet, took metformin, then also got into this low sugar. Then I said, please go to your diabetologist in Boblingen. And the diabetologist said, yes, you have to eat more bread for the medication to work.
Ouch. Wow.
That was hard.
That was really hard. And then I thought, okay. I had another diabetician who was with the Diabetes Nutrition Council, and he said, you must not eat fruit at all. Fruit is very bad. I mean, 30 years ago, fructose was the diabetic sugar, so by the way. And I said, what do you eat then? And he said, yes, I eat cookies again, rolls, noodles. Oh, but no fruit. Where the sugar is a bit packed, where antioxidants are included, secondary plant substances, which I don't have in other things. And maybe a sugar that doesn't go into the blood as quickly as a cookie or noodles.
It's unbelievable. I really have to say, this whole DGE topic, how you actually let the diabetics go completely against the wall, that was really. So it's still like that today.
I don't know if I think it's worse today. I've been talked about it recently, not quite 30 years in business. And I think it's more like this tendency, it's impossible, you can't force people to change their way of life, which has usually led to it. But not only, but has clearly contributed to it. Why can't you do that? Why can't you force someone to do more for their health? That always has such a negative connotation. No, then you'd rather increase the insulin dose, go from 750 milligrams to 1000 milligrams metformin. That is permissible, but not that you eat differently.
Yes, I think then there is the load taken from the people that they are responsible for their own health.
Yes. Absolutely. It's even somehow made up that you can't do something yourself. It's even made up that you can't do anything yourself.
When I think back to all the interviews with you and Thomas Rau, how you do it, I think, no matter what you have, if you really do it in the detoxification and intestinal topic, then you have done a lot, and then look what is still there.
In der Entgiftung und in der Darmthematik einfach mal das macht, dann hat man doch mal schon mal viel bewegt und guckt mal, was dann noch da ist.
We call that causing treatment. Yes. Sometimes I think, oh, let's do a show about diagnoses and the beliefs that depend on diagnoses. Oh, if I have a diagnosis, then you can treat it. That's usually not true. No. But if I treat causes, if I apply healing powers to the body, if I bring the body back to self-regulation, then it will cope with it by itself, or even better.
Super exciting. I'm always happy when you come, Alexandra. I love it when you work in such a holistic way and pick up the patient where he is.
Den Patienten da abholt, wo einfach auch steht, gell?
I hope you'll be
Ich hoffe,
back
dass du bald
soon.
wiederkommst.
There are
Ich
still a
muss ja noch
few
ein
hot
paar
topics in our
lernen,
society.
deswegen aktuell in unserer Gesellschaft.
I
Und
look forward to
freue
welcoming
mich,
you
dich bald
again
wieder hier
soon.
begrüßen zu dürfen.
Thank
Danke.
you.
Ja.
Thank you for
Vielen
watching.
Dank fürs Zuschauen und ich
I
wünsche
wish
Ihnen
you all
auch
the
alles
best and that your
Gute und
body
dass
always stays
einfach der
healthy and
Körper
fit.
immer gesund und fit bleibt und
See
bis
you
bald.
soon.
Tschüss.
Bye.